When America sneezes, the rest of the world catches a cold. Are y'all feeling the shivers yet? Oh, the USA has left the World Health Organization. Let's discuss what this means for the African continent, its women, and its girls. From salt to sustainability, this week we are going to be shining light on a phenomenal group of women who are reshaping their future. And let us give flowers to an exceptional entrepreneur who is transforming waste into wealth. Yeah, you heard that right. She's transforming trash into triumph. Can I get an amen? Guys, we have so much and insightful things to discuss in this week's episode. I cannot wait for you to join me, so stick around because it's about to be a ride. Hello everyone, welcome to another awesome episode that we're about to have. I'm so excited to have you here and get into the thick of today's topic. As you would have seen today, we are discussing something that has, to some was a shocker, to others it wasn't really, And before I get into today's topic, I just want to give this quick disclaimer, that being that this video is not here to bash the USA or to bash President Donald Trump, and I just think it's because that's just not the focus of the overall aim that I'm trying to achieve when it comes to today's topic, but also because I think Africa is not the only country that's going to experience drastic changes in terms of its diplomatic relations with the USA. I think the whole world is in for quite a significant shift, right, in trajectory with, President Trump being in office for the next 4 years. So that for me is just like, it's a different angle, and it's not the rabbit hole we're going down in today. The rabbit hole we are cruising into and focusing on today is basically unpacking what the withdrawal of the USA's funding from World Health Organization will mean for the African continent, and more specifically what it will mean for women and girls when it comes to their healthcare. And I specifically want to highlight this because this is a particular part in, I think, Africa's healthcare that is oftentimes neglected and its issues are not highlighted enough. So we will use this platform to try and, remedy that. But also I do want us to look at what are the possible lessons that we can take from this as a continent, and take these lessons as a way to inform ourselves on how we move forward, how foreign policy should be, informed, but also we to look at what are the opportunities that exist. And I say opportunities because I'll take it from an entrepreneurial point of view, right? Some entrepreneurs will tell you that the way in which they came about the idea for their service or their product was that they realized a certain problem or a certain gap in the market, and they came up with a solution for that, right? And so their coming up with the solution was ultimately the opportunity that allowed them to commercialize their product or their service, hence them going down the route of being an entrepreneur or a business person. Obviously, we're not talking about entrepreneurship here, but I do believe that we can learn from that kind of thinking and really try and see how this problem can most probably be used as a way to pivot us into other opportunities that maybe we are not necessarily focusing in on. And as always, guys, because I don't want the videos to be too long, I'm gonna put the stats here, like somewhere on the screen, and these will be stats that are related to what I'm saying. And I just do this because, again, we want to be very efficient with the time that we have, and also because there's so much to get into and we unfortunately don't have the time. So it's it's just a simpler way of making sure that I get out everything that I want to get out there to you guys. You know what I'm saying? So with that, let's get in quickly on just at a surface base, at a surface level. What does the reduction of this funding that the WHO gets from the US, what does it mean for Africa, right? And also, let us not forget that America has got two significant roles when it comes to the World Health Organization. The first being that it is one of like the founding members of this, international organization. But secondly, it is the biggest donor, right? So the first thing is the most obvious. There is going to be a huge reduction in health programs specifically being those that are focused on disease prevention, maternal and child health, vaccination campaigns, HIV and AIDS and TB related, initiatives, as well as the combating of malaria and, issues such as cholera on the African continent. These life-saving programs are going to be jeopardized immensely, because it will now mean that those who are contending for sponsorship are doing so with a much smaller donor pool. And let us also not forget, guys, that WHO doesn't only just fund governments, but it also does fund, individual agencies, institutions, organizations, programs, etc. Another thing that is going to be affected is that there's going to be a weakening of disease surveillance and outbreak response. So we have seen that in Africa, in certain parts, there is like a prominence of, various diseases and viruses breaking out every so now and again. What the WHO has really played a great role in is really helping to provide surveillance systems, or rather monitoring systems that track and control these kind of pandemics. And we see that these are effective in how, for example, in the recent Ebola outbreak, it was really nipped in the bud really quickly, because they have learned how to be proactive with the virus and the diseases, and so it just makes it much quicker to manage, right? And also, this is pandemics and diseases and viruses, they seem like they like an occurring thing now. So this kind of resource is it's a valuable need, right, when it comes to maintaining healthcare systems and making sure that just everyone stays alive, at the very least, at the bare minimums, that citizens stay alive, right? Another thing that is obviously gonna also be affected is the vaccination and immunization campaigns, and these really have been more prominent when it comes to dealing with things like malaria prevention, measles, polio, and even we saw with COVID, in the aftermath of everything, vaccines were like a huge assistance in combating the virus. So this means that there just might be a severe delay in these products being rolled out to various countries. Also, there will definitely be an increased burden on the already fragile health systems that we already have. I know, particularly in South Africa, we are facing a case where a lot of doctors, nurses are not employed due to various economic factors, and so there being a limit of funding just means that either doctors and nurses and all healthcare workers will be severely underpaid, or overworked rather, or if not that, many might just lose their jobs because the clinics, the organizations that had the funding to be able to pay them just can't do it anymore. Another thing is that there's going to be a huge impact on the global health research aspect of things. And why research in Africa is so significant is that it provides us with the data that informs us on who needs to get what, where, and how. And data, guys, for a continent that has 54 countries and the number of people that we have on this continent, data really is essential in helping keep everything on track, in helping make sure that resources of all kind, whether it's like, you know, human resources or, you know, various products and services, are allocated accordingly. But also it gives an indication for future planning, or even with policy, what needs to be improved upon to make sure that the well-being of citizens is made a priority. Another thing, guys, there will be a loss of leadership and influence, right? And what I mean by this is that America, you know, is a country that is a world leader in a lot of things, right? They are a world power. I'll never forget the first time I heard a quote that said, when America sneezes, the rest of the world catches the flu. And this was just to illustrate just how powerful of a player America is when it comes to the geopolitical space on any and every topic. So if America is looking inward and is very much about its own self-interest, it could set about the tone of other countries following suit. That's putting Africa at a huge disadvantage, especially when it comes to us, you know, being able to get the necessary aid when it comes to healthcare issues, but also even from a climate change perspective, because we know that they've also pulled out from the Paris agreement. It does mean that our environmental issues will not necessarily be prioritized, or commitments that were made will not be lived up to, because again, if people be like, well, if America's not doing it, why should we do it? And this is, especially from an environmental point of view, this is very unfortunate, because of how, as we know, we have as a continent contributed the least to many of the climate issues that we are faced with currently, but we are suffering the most. Hey, like we are feeling the brunt of it the most. This ultimately then will obviously lead to there being a lot of dependence, increased dependence on other parties. So we will see a lot of African countries really diversify their partnerships in terms of turning to countries like China, Russia, UAE, to be able to find, you know, the support that they need for their health priorities. Another one which really broke my heart in terms of like doing research on was just realizing the setback that this is going to get put on us when it comes to pandemic preparedness. And again, it ties into a point I made earlier on about just how, you know, one thing COVID taught us is that we really need to know how to be proactive. And to be proactive, it means that we have to have trained healthcare workers. It means that we need to have lab facilities that will always be, you know, checking what's happening with who, how. Also, we need to be able to ensure that everybody is capacitated for that kind of emergency. There needs to always be an emergency supplies that are ever ready for a time that a future pandemic will happen. And there being this cut off of resources really does limit that, because now people will be more focused on dealing with current issues and no longer have that legway, you know, or that leeway in a sense to focus in on, you know, future possible pandemics that could happen. And another thing, a final point to this will be how I think people's trust or states' trust in, you know, global health governance is really going to be affected. So I really think that, you know, the WHO is going to have a very difficult time in really reinforcing the fact that it is, you know, a institution that should be taken very seriously, and that is actually effective in what it is doing, because many countries will now just be like, well, if people can pull out willy-nilly anyhow, then, you know, are you really that serious of a player in this global stage? So those are at a very, you know, generic level, some of just the main things that I think we could possibly be impacted. When it comes to women and children, the first thing I want to talk about is there's going to definitely be a reduction in maternal and child health programs. And guys, this is so important, because the rates that we clock for the kind of like maternal deaths on the continent are just really so heartbreaking. And just to share one particular scenario is that not all communities where women are at have a clinic. Sometimes the clinics are like kilometers away, and so a woman will pass on simply because as she's in active labor, she's having to make her way, and many a times it's to walk on foot to the clinic. So by the time she even reaches the clinic, it's either she's exhausted, or maybe even if the baby's breached, and she has to already start pushing, and you don't have the necessary assistance. As a result, mother and child both die. So these are just like small things that, with the kind of funding that WHO's offers are now slowly starting to be mitigated. But again, this is going to be severely affected. Another thing that's going to be affected is people's access to reproductive health services. These health services include everything from education on reproductive health, contraceptives, family planning, and everything that really involves that sector. Families or women rather, will really have a hard time being able to gain access to those services and products, because as we know, in most African states, these kind of products and services are subsidized heavily by the government, and the government is able to subsidize them because of the funding that they get from institutions such as the WHO. So it just really makes me, that's literally how it has me feeling. Another thing is it's going to really hinder efforts to combat gender-based violence. The WHO has been so great in how it's partnered with a lot of not only government institutions, but civil society organizations to really try and combat GBV from various angles, whether they're dealing with it from the angle of early childhood marriages, whether they're dealing with it from the process of FGM, whether they're dealing with it from intimate partner violence or femicide. They've really made a concerted effort to try and really set up initiatives that will ensure that women are not subjugated to this silent pandemic. And the funding has gone really to initiatives that provide critical support services such as shelters, counseling, legal aid. So that also might be heavily impacted, because most of the people who do this, even though not always, it's not always the case that they are volunteers, but they're not really getting paid like this huge amounts of money to do this very life-changing work that they do. Another issue is that there's going to be setbacks in HIV and AIDS treatment for women. And I bring up for women specifically because 60% of women and girls in Africa are affected by HIV and AIDS, and the age gap is 15 to 24. And so the World Health Organization has been really, instrumental in setting up programs that allow for HIV and AIDS prevention, testing, and treatment services as well. So this could also be severely impacted. Another place that's going to be threatened is in the ability of women to get safe vaccinations campaigns, specifically for issues such as not HPV, but cervical cancer. And cervical cancer is the second most common cancer that women in Africa get. So they normally get the HPV vaccine to basically help combat this. And that means that now they won't necessarily be, this vaccine won't be readily available. And even if it is, I think there's going to be prioritizing of which countries will be able to get it, considering that not all countries are on the continent are at the same place in terms of their development and their stability. So I'm pretty sure that conflict-ridden countries will be severely prioritized during this time. And then also adolescent girls will have limited access in terms of services that they can get. And when I say services, I mean services that are related to reproductive health education as well as mental health education. This is so important because, as I mentioned earlier, that a lot of young girls are still faced with, it's really as a pandemic of child marriages. And in these child marriages, most of these young girls, as soon as they get pregnant, life has really come to an end for them. And so, you know, these kind of services of family planning affords them the opportunity to at least be able to pursue education, pursue some kind of job that will afford them a livelihood to better themselves, as well as the subsequent children that they will end up having. So these kind of services are really, really important. Another thing that will be severely impacted is there will be limited access to clean water and sanitation. And this is really important, especially for young girls, because we know that many young girls, when they are on their menstrual cycle, they either don't have the menstrual cycle pads that they need, and as a result they'll stay home, or if they do have that, they will stay home because at school there aren't the necessary facilities, right, whether it's water and sanitation or that is needed to ensure that they maintain, you know, their hygiene. And guys, as a young girl who, you know, is on her menstrual cycle, there's a lot that young girls are going through. So, you know, to be able to have clean water to ensure that when they go to the bathroom and they have to change, they can just, you know, quickly touch up and make sure everything is fine. It goes a long way in, you know, just, you know, ensuring that the esteem, the dignity and the integrity of the girl is still kept intact while she's still able to pursue her education and not have that be affected by something really that is really beyond her control. Another thing that will also really be interrupted is the vaccinations of newborns and infants. We know that in a lot of cases where there is some kind of universal healthcare system, when babies are born, they are told to come back to these various clinics to get the necessary vaccinations that they will get. And this is going to be heavily you know, affected. I was reading one stat that was saying that 8.5 million children were unvaccinated in 2021, and I'm guessing that this was heavily impacted also by, you know, COVID in 2020, whereby many of the women could not really go to these various clinics to get their children you know, vaccinated. Another thing that will be unfortunately negatively impacted is that there will be a reduction in investment in midwifery and nursing programs. And these again are important for communities whereby, let's say, the women are far from clinics, they can then have a certainty that, you know, a midwife or can be able to come to them to assist them with birthing, make sure that they have a safe birth. So these healthcare workers really do provide an essential basic, you know, health need and right, and that might see a decrease, which is very, 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 very unfortunate. So these are just some of the things that, you know, women will be faced with. And with that, I want to then move on to what lessons are we to learn from all this that is happening, that being the USA pulling out from the WHO. The first lesson is that African countries need to prioritize health systems, and they need to prioritize them in a way that they come up with programs that will be sustainable. So whether it's creating universal healthcare coverage or whether it's creating equitable access to healthcare for all, whatever it is, there just needs to be a serious, you know, concerted effort in really figuring this out, because again, self-interest is a thing, and if America is already starting on this trend, we cannot be surprised if other countries follow suit. So Africans also need to look within. We need to, you know, focus. Let's pull ourselves toward ourselves. Another thing is that there has to be an emphasis on there being an increase on domestic resource mobilization. I think here a philanthropy can play a huge role. And guys, you know, in Africa we have quite a lot of phenomenal philanthropists. I just often say, like, government alone cannot fix the problems that we have. There has to be like a partnership, yes, between government, civil society and private sector, that being philanthropists or, you know, whatever corporate social initiatives that businesses will want to choose to have. And really truly this kind of partnership can assist in that. Where government's power and abilities end is where civil society's, you know, power and ability can end, because civil society is made up of like grassroots organizations and various programs, etc., etc. So there needs to really be a partnering of the like, and really what the the private sector can do is really to serve as a bridge for financing both these sides that are doing a lot of critical work. Another thing is that we need to really be intentional about, you know, strengthening local health workforce. And so, yeah, just a lot of programs need to be put in place, or just, I think, yeah, government really needs to incentivize, I guess, you know, investors to be able to train and retain a lot of like doctors, nurses, and healthcare professionals who will be able to serve within their local, you know, populations or local communities. So another thing that definitely needs to be improved on is data collection and monitoring systems. I will not go into depth with this because I already said earlier on the significance of data, but we really do need to start supporting, even if it's supporting our national statistics in institutions, and really ensuring that they are fully capacitated to keep track with what is happening with our healthcare systems and where do improvements need to be made. And those statistics should help inform policies that will be implemented and ultimately affect, right, everyone else. Another thing is we do need to focus, guys, on preventative healthcare and education. As we all know, prevention is better than cure. So if more people are able to be exposed to programs that bring awareness and capacitate them on how they can prevent getting various diseases and viruses, it just puts less of a strain on the healthcare system, because again, you won't be having to attend to like an influx of people who are suffering from said, you know, whatever issue, if they know how to go about preventing themselves from getting that issue in the first place. And the final one that I will, you know, touch on is, you know, there being a serious integration of our current health, you know, I guess health models and all of that, integration of that with, you know, AI and the fourth industrial revolution. I believe it was in Rwanda where they were using drones to send prescripted medication from the doctors to like these remote villages that would normally through the normal means of like transportations would take hours, or even in some cases days, right, to deliver. So, you know, small significant changes like that go a long way in ensuring that, you know, healthcare is accessible to everyone and is affordable. I know also the other, I believe I heard of an initiative where people are wanting to bring, you know, use AI to allow for virtual consultations. So these kind of things, we really need to look at them even more deeply, because I do think that they will play a very crucial role in really helping us pivot from this current problem that we are having being a problem to it being an opportunity. And so with that, I then want to look at what opportunities do we have. Opportunity number one, again, strengthen the African Union and African Center for Disease, it's African Center for Disease Control and Prevention. These African institutions already have got established frameworks, systems, etc. on what it is that, you know, particularly African countries need. And in most cases, all they just need is the necessary funding to either implement or upscale existing programs. So let us strengthen these regional bodies. Also, in us diversifying our partnerships, we need to make sure that, again, we are getting the full advantageous benefits, and not just us coming to the negotiation table with our hands stretched out and just like, oh, we're willing to take whatever you're going to offer us, China or Russia or UAE. No, we really need to be intentional about what we bring to the table of negotiation and what our ask is as we are diversifying our global partnerships. The final one I will end with is to make sure that we prioritize manufacturing. I believe COVID was a huge lesson for this, because of how when vaccination rollouts happened or were taking place, Western countries looked within. They focused on making sure that they are good and they have everything that they need, and even have more, before they thought about, you know, sparing what they had to, you know, us African countries and other developing nations. And so that should have been a huge indicator for the need to really accelerate the need of us industrializing and making sure that we can manufacture our own things. So with that, guys, I hope you've been able to just get a new perspective on this issue. And with that, I do hope that African countries will again take this as a lesson to really understand how international relations works, and that the first rule in this game is that it's a zero-sum game, and it's every man for himself, and literally God for us all. So Africans, let's get on board with everything that's happening. And with that, guys, we are going to move on to women across Africa. Okay, guys, we are in Women Across Africa. I'm gonna share two stories. I'm gonna really try to rush through this because, oh my god, time. But the two stories I have to share today, the first one is gonna touch a lot on like environmental issues, and again, this is just my way of touching in on the US pulling out of the Paris Agreement. And I'm touching in on this story because I think it is showing us in real time, again, how we are not only just affected in terms of like just the floodings and the droughts and the famine, but real livelihoods are being threatened because of everything that is happening when it comes to the climate. So the first story I'm focusing on is from Tanzania, and it's focusing on the Pemba's women's salt farmers, and basically looking at how their livelihoods right now are really threatened due to climate woes. So essentially here in this community, we are dealing with female farmers who are salt farmers rather, and they are in a it's an unfortunate situation already, just unfortunate in the sense that the kind of setup that they have is one that does not allow for them to have like a surplus of like money. It is a tough job in the sense that harvesting, or I guess mining salt, it's a very strenuous job physically, that is. I'll even read one of the quotes that were put down in the article, and it said that it's from a 31-year-old mother of 3. She said, "It's a tough job. The heat is too much. No matter how much water you drink, the thirst won't go away. But it's how I feed my family and I send my children to school." So as we can see, this is a grueling craft that women are engaged with. Now, how is climate change playing a role here? So the formation, right, of salt crystals has to happen within a particular environmental condition, and this is now affected when there are floods that happen frequently and happen unexpectedly, which has been the case with these female salt farmers. And so what they are saying they are confronted with is that normally there would be a flooding season where they would know that, okay, in this season we mustn't be expecting too much of output because of the fact that there's going to be severe floodings, meaning that salt won't be crystallized, meaning that we're not going to be able to get the iodized salt. But now it's coming in at unexpected times, and it's coming in unannounced, and it's happening so frequently. Hold on. It's happening so frequently that it's obviously affecting their ability to make ends meet. And so one of the amazing things that has come about as a result of this is them coming up with like eco-friendly solutions, and the eco-friendly solutions that the local woman, through the partnership of like an organization, was to basically to bring the introduction of solar drying covers. So these are covers that they put over the ponds, And what they ensure is that though the water comes and there's flooding, it doesn't necessarily affect, I guess, the beds that, you know, make the salts form and crystallize. At the same time, these solar drying covers underneath, they ensure that underneath the covers, the beds have the necessary heat to continue to formulate, you know, these salt crystals. So these things are just like some of the, you know, initiatives that are helping to keep their livelihoods afloat. But more than that, they are also helping them to, you know, increase their outputs, as such be able to sell salt in bulk rather than just selling it in like these small quantities. Because another thing with this kind of salt farming is that the land is owned, right, by various companies, and so what happens is that whatever it is that the women make, a bulk of it goes to that company, and then they'll remain with a few that they can go and sell for their own, you know, for their own profit. So as you can see here, this is just one story that is illustrating how women who are already in it's a Muslim dominated community, it's a community that already women don't have a lot of opportunities in, and it's like the one avenue that they have forged for themselves to ensure that they bring in a certain level of income that doesn't only support them but supports their children as well, is being threatened by something that is really out of their control, and they really don't have much that they can be able to do to try and mitigate it. And so again, you know, these kind of things should really start you know, pushing African leaders to think innovatively, you know, and inventively about how it is that they can get ahead of the game when it comes to them not being so dependent on outside, you know, nations to help us solve many of these internal issues that we are confronted with. And then my second story is going to be focusing on the African Women in Dialogue event. This is an event that brings about 1,000 women around the continent to come and discuss critical, you know, issues that women are faced with. I really love this whole week-long dialogue because of how it just, you know, proves my point. I think I said it in 2 videos back when I was talking about the Botswana's youth minister and something she had said in her statements about amplifying voices. And I had made the point that as a people, we are not homogeneous, meaning that we are not the same. And so our interests, our demands, our needs, our wants are not going to be the same. And so we need to have more spaces that can allow for these various voices to be heard, and most importantly to be acknowledged, because when people are well informed of what it is exactly that people are faced with on the ground, it allows for us to have multi-layered approaches to the solutions that we want to solve. And most importantly, it ensures that we give, you know, accurate diagnoses, you know, to the issues, and not just far-fetched, you know, theories that we want to try and implement in situations that they don't even fit in, you know, they don't even belong in. So yeah, this event, it's just it's amazing in how it has informative presentations, it's got panel discussions, it's got various workshops, and it really is an empowering space that allows participants to share, learn, reflect, and really network. And I also love and appreciate the fact that they bring women from different walks of life, so business leaders, government leaders, they bring women from civil society, public sector, entrepreneurs, activists, students, you know, homemakers, the whole 9 yards. And I won't say again why this is important, but this is important. I think if we are going to craft our own table where we discuss what it is that we want and we come up with the solutions, we need to make sure that everybody has a seat, and we need to make sure that everybody is welcomed. So I'm really excited for this event, and maybe to even hear in what some of the outcomes of the meeting will be. And with that, guys, we are going to move on to Woman of the Week. As I always say, if you have made it till this far, you are thebomb.com. And thank you so much, guys. We have reached the end of our show. You know, today's episode did go on a bit longer than normal, but again, we were discussing something that really is important. And another thing I'm really realizing, whenever I discuss something that has to cover the whole continent, like, it's so difficult to try and, like, you know, squeeze it into like 20 minutes, because again, like, there's a lot, you know, but we're trying, we're gonna get better. We're gonna keep on finding more ways, more innovative and effective ways of being able to share this information. But with that, guys, this week's Woman of the Week is taking us to Nigeria, and we are meeting a woman by the name of Ife Dolapo, and she is a Nigerian businesswoman and a seasoned banker, and she's really carved a niche for herself as a trailblazer in waste management and recycling. She is the founder and CEO of Free Recycle Limited, and this company basically just has an unwavering commitment to, you know, sustainable, environmentally friendly practices and innovation within their country. So a bit of background context to her story is that she comes from a community, or a town rather, I believe it's Ibadan, if I'm not mistaken. If I am, I'll insert the right state here. But she comes from that state, and the state really has got a huge influx of a huge amount rather of waste when it comes to tires and them just laying around. So she came up with this company to basically take these tires that have been discarded and make, you know, sustainable products such as tiles and various other amazing products. And what I really love about her work is that she has, you know, served as a voice who is really spearheading the discourse on environmental stewardship, and she's really inspiring positive change within Nigeria and beyond. And I really wanted to, obviously, as always, end on this positive note, and a note that just goes to prove the point I was making in the beginning of this video, that problems can, when we have the right perspective, you know, the solutions that we give to those problems can really pivot into opportunities that give us like a future that's even better than one we could have ever imagined. So with that, guys, let us not fear or fret with the various changes that are happening in the world, because they are plenty. Rather, let us be encouraged, and let us, you know, take courage in the fact that we are a resilient people, and as long as we are able to put our heads together, come to the table, we can always find our way out and into the light. So, and with that, guys, thank you so much for joining. I will catch you on the next one, and again, don't forget to comment, to subscribe, to like, share this with everybody, and thank you so much for those who do, you know, make their comments down below, because again, y'all are listening to when I say the conversation doesn't end over here, okay? And I really do enjoy engaging with you all. So thank you, and I will see you very soon. Goodbye.
There was a day I was traveling down to Ikene, and refuse burning has been going on for a couple of days. So the entire environment was heavily polluted. So at that very moment, I was discussing with my husband. I was like, what can we possibly do with tires, you know? And so that's how it started. My name is Ife Dolapo. I'm the founder of Freetown Waste Management Recycle Limited. Straight out of school, I worked as a call center agent with Airtel, and then from there I was in the banking sector for about 9 years. From the banking sector, here I am today doing this. In terms of geographical area, Ibadan is the largest city in Nigeria and the third largest in terms of population in Nigeria.
Up until now, you see what they do with scrap tires. During riots, they burn them, they use them as vigilante, and this depletes the ozone layer.
Also typically find tires in some drainages. We know what happens during the raining season. That's a breeding ground for mosquitoes. So by taking out this waste tires, we're reducing carbon emission, and we are also tackling the spread of malaria in our environment.
We have used over 60,000 tires to produce over 2,000 square meters of tiles, over 5,000 rolls of rubber materials. Still counting, we are still doing more.
Operations was meant to commence early 2020, and then COVID happened. Because our equipment were meant to come in from China, that couldn't happen. So we're forced to look elsewhere for our equipment. That in itself resulted in delays. How do you say to someone that I can't pay you, or because we can't do anything, but this person left where they were to come work with you? So it was really tough, and it was really emotional. But at the end of the day, we were able to pull through. It can be better, and I know that it will be better. No, so far the impact, it's been massive.
We've empowered so many people, the organizers, the artisans.
Iṣẹ́ organizer ni mo fi ń jẹun. Mo dẹ̀ ti ń kó táyà yẹn jọ ní méjì mẹ́ta kó tó wá rí pé ó pọ̀ kó tó rí pé mo ń tà fún àwọn tó máa ń rà.
We get the tire from organizers, those condemned tires, we buy them, we pack them, then we bring them inside the company.
Our process starts from the girls. Once we collect tire from the vendor, we take it down straight to the tire washing section.
Before I got here, I normally sleep at home. I would sleep 7 to 9 at times. That did nothing. But once I got here, I changed a little bit, and since then I've been doing fine. They pay your salary.
Nigeria can be a bit difficult. We have so many innovative people. You know, it still all boils down to what support we can get from the government and what they are paying attention to, what they are willing to focus on. It's quite critical to our growth.
Presently, we have developed tiles of different ranges. We have the plain tiles, and we also have mat. The mat can be used for insulator for panel rooms. We are looking at using our scrap tires to do speed bumps and also bollards and some other new things rubber can do.
So we also recently started a back to school campaign where we're encouraging schools to use our product instead. You don't have to worry about injuries during playtime. When you're tired, you can always bring them back. It will never be wasted to us. We can recycle and then still make something out of it. So yes, anybody, I would say, in different sectors can use our products. People still don't want to have this conversation about climate change. It is real. We all have to open our eyes and see that unless we actually do something, there won't be anything left. I mean, I have no intention of moving to Mars, and I'd rather be on Earth.